Good afternoon, everyone. I'm Governor John Carney for our weekly press conference on Delaware's response to COVID-19. Thank you for joining us once again. Appreciate those of you who are with us every week, who stop me on the street to thank us for giving the information that we share with you during these press conferences. Appreciate that feedback, particularly when you tell me what you're looking for and some of the questions that you have. It does help us as we work through our presentation each week. I'm joined again by Dr. Carol Rattay, who's the Director of the Division of Public Health. She and her team just amaze me, continue to do tremendous work in so many ways, from testing to contact tracing to our vaccination program, just everything in an unprecedented way for almost a year now. So it seems like about 5 years, but it's only been a year. AJ Shaw, our Director of DEMA, who has been doing a tremendous job coordinating testing and now our vaccination system, working with Dr. Hong, just a really good, strong team. A very challenging situation. There's an article recently that ran, it talked about the issues, and the issue is really pretty simple. We don't have enough supply. We don't have enough supply for those who are demanding to get vaccinated, and it really all comes down to that. Pam's with us today again, our sign language expert. Thank you for being here for the deaf and hard of hearing so that they can tune in as well. Let's go right to the data. We have some good news to report today, and it's a function of the mitigation efforts that folks have been following. Mask wearing, I was on a conference call with the mayors in towns and cities across Delaware earlier today, and they each reported that compliance with the mask wearing mandates is in the 90% range. People are getting tired of it a little bit, but we're seeing a positive results. The most positive result, of course, is on this chart is the hospitalizations. That number was almost to 500 in the 470s just a couple weeks ago, now under 200. But to think about it in the longer trajectory of this pandemic, back in the summer, we were under 50 for hospitalizations. So we still have a ways to go, but this is half of what it was, more than half of what it was just a few weeks ago. New positive cases continue to decline. There are some hot spots that we're concerned about that Dr. Rattay will talk about. We're moving closer to that 5% positive of test results that we're doing. And of course, that is in part a function of the number of tests that we are doing, which is a big number, well over the 80,000 goal that we set for ourselves some time ago, 2 or 3 times that amount over the last 2 months. So we're right above it at 5.5% on a 7-day moving average. And then sadly, we're almost to 1,300 lives lost in our state, and a reminder of the seriousness of this virus and the sickness that can occur, particularly for the older, vulnerable populations. And I know everyone's friends and families of those we've lost during COVID are suffering through that loss. The testing totals, as I said, we've tested over 600,000 Delawareans. Our population, of course, is around 970,000, just short of a million, and we've tested close to that number. And certainly the number of tests that we've administered now at 1.3 million, surpassing the rate that we set as a goal many months ago. On the vaccination side, importantly, we've received over 160,000 doses delivered from the federal government, and we've administered 154,000 through state public health run clinics and through our partners, hospitals, pharmacies, primary care physicians, federally qualified health centers, and others. And with our goal of getting these out as fast, as efficiently, and as equitably as possible, we continue to get additional supply from the federal government. We were on the White House call this morning, alerted to the fact that we will get some additional supply They are directing allocation to pharmacies and federally qualified health centers directly. It won't come through the state. We are making allocations from the doses that come from the Division of Public Health to those partners as well. And so we'll be able to increase the number. Our focus this week will be on second doses. We'll talk a little bit more about that. Dr. Rattay will talk about that and some of the clinics that we're opening up for appointments kind of as we speak or in the near future. The rate of positive cases is the next one. You can see the run up since the Thanksgiving holidays, November, early December, and through the December holidays into the new year, and now flattening off and heading in a positive direction. Next slide shows that as it relates to hospitalizations. You can see the peak back in the end of April, early May, and then the flattening out during the summertime in August and September, which is when our hospitalization number was at its lowest. You can see that on August the 16th, the low of 29. We had run up to 337 in April. And then you see the run up in number of hospitalizations from November to the 2nd to the peak on January 12th of 474. And now we're back down under 200 at 186. Part of that is a function, the fact that the hospitals are better at treating patients that come into the hospital. They're using techniques to keep patients out of the hospital in the first instance. And so the hospitals have been doing a great job in treating those who are sickened with COVID-19. Again, as I said, this week we are sponsoring a vaccination site at the Dover International Speedway for several days in partnership with FEMA, our federal partners there, and they are sending thousands of doses, which we will focus on individuals who receive their first dose at DMVs and the Salesianum clinics on or before January 24th, again, with a focus on getting those second doses out to the several thousand people that receive their first dose at those clinics at the DMVs in Georgetown, the DMV at Delaware City, and then Salesianum School. This is an opportunity made available by the federal government using our supply to really focus on making sure the folks that received their first dose at those clinics receive their second dose here at Dover International Speedway. We understand that that requires some folks to travel, but it's a way to get thousands of folks their second dose and the full vaccination. We knew that this would be a tough winter as people moved indoors with the holiday seasons, starting with Thanksgiving. And we've seen that with the number of cases running up to a high over 800 positive cases a day, with hospitalizations that peaked at over 470. And of course, fatalities which have continued through the winter. But Delawareans have stayed vigilant. Again, as I said earlier, the report that we get from the mayors is that people in their towns are complying with mask wearing guidance. That's a really good thing. Dr. Rattay is going to talk later about double masking, which is something that I've tried myself as I get to the gym and I'm out in public gatherings to make sure that I'm protecting others from if I were positive and vice versa. So that's a really positive thing. Our numbers are better, but we're still not out of this yet. So we need everybody to bear down on this and wear a mask, keep socially distanced, avoid gatherings with folks outside of your households. Be careful when you're going into public spaces, and make sure always that you're wearing a mask. So with that, I'm going to turn it over to Dr. Rattay, who can expand on our focus on second doses, as well as double masking and other issues that we're focusing on this coming week. Dr. Rattay.
Thank you so much, Governor. So let me start with, as always, our areas of concern. And as the governor said, our numbers are looking good, especially our hospital numbers, which we're very excited about. We did get more people tested this past week, and as we know, when you do more testing, sometimes you catch more cases, which is a good thing, right? But we actually have some additional zip codes that are over kind of a new criteria, 400 cases per 100,000 people. Last week, that would have been 3 zip codes. This week, 5 zip codes would meet that criteria: Georgetown, Harbison, Harrington, 19804 or the Newport Stanton area, as well as Frankfurt. So, it's certainly much better. I was looking a little while ago at a report from early January where all of our zip codes would have met this criteria. So again, we're doing much better than we were, but some of our increases that we saw are in Sussex County. So we just want to make sure people are, cautious. Even though we're doing better, there's still a lot of infection around. So let's switch to some updates from the Centers for Disease Control. This past week, the CDC did come up with some new guidance based on a study that was done around mask wearing. They looked at transmission of droplets, comparing just like a single surgical mask, as well as masks that were tightly fit around the face, as well as double masking. And what was shown was that the transmission of droplets is reduced 95% if both people in the room are wearing tightly fitted masks. And really the key point of this is that you want to make sure that you have a mask that's really fitting tightly around your face. Double masking can help because you can just get a tighter seal around your face. And of course, additional layers are beneficial, but also just using a single mask, you can tie the loop close to the mask, and that will make it so that you have less gaps and it's tighter. Also good to use those kinds of masks that have a wire at the nose, because that also really helps a lot to make it fit more snugly. There's also some other options. So for example, there's something called a mask fitter, and even some people who will wear more like a tight gaiter or nylon covering their mask. But the main point we really want people to be thinking about is, if your mask is big and there are gaps around it, you're putting yourself and others at risk. So, take a look in the mirror, see how your mask is fitting you. Ask your neighbor, does it look tight? And, think about the different options that can make it safer for you. CDC also came out with some new and updated guidance for those who have been exposed to COVID after they have received the vaccination. So as we've talked about before, the vaccines, the Pfizer and Moderna vaccines are very effective in preventing severe and symptomatic COVID-19, extremely effective in preventing death and hospitalization, which is obviously extremely important. But what is still being studied is how effective are they in decreasing transmission. We know intuitively it does help with decrease of transmission, but because with this virus, there is a lot of asymptomatic spread. There's a lot of caution still around, once you've been vaccinated, it's not, a hall pass to go without a mask and to no longer social distance. However, from CDC's investigation of the science, what they're saying is individuals who've been fully vaccinated, and at this point, our only 2 vaccines require 2 doses. So you need to you have received the second dose plus 2 weeks. So if it's been 2 weeks after your second dose or more, but less than 3 months, and you don't have symptoms, then you don't have to quarantine after you've been exposed. I just want to make a mention about the time frame around 3 months. That's really there at this point, just because again, we haven't been able to study the effects of these vaccines long enough yet. So of course, this guidance may change as we learn more. But at this point, I think that's really good news for those who have received 2 doses of the vaccine, that if they've been exposed and meet these criteria, they don't have to quarantine. So let's move on and talk about vaccines. Really excited that 154,000 doses of the vaccine have been administered so far. And that's almost 120,000 first doses, but a lot of second doses have been administered as well. As you all know, we opened a wait list for those 65 and up on January 20th. The wait list has a total of 114 people on it. And at this point, about 43,000 of those individuals have been vaccinated. So of course, it's not fast enough for any of us. We've said so many times, we're really, really eager to get more vaccine and to get more vaccine quick here in our state. But we are really grateful that 43,000 senior citizens in Delaware have received at least their first dose. Let's go to the second slide, because we really want to focus on second doses. As we've said, it is our obligation to ensure that people who get their first dose also get their second dose. And as we announced last week, we really are focused right now on ensuring that the state has vaccinated through our clinics have access to their second doses. And as you may recall, well over 20,000 people attended our events over several weekend periods of time. For those who received their vaccine at Sally's, public health is working with some of the community groups that such as Kingswood and LACC, which AJ's group team is actually there at LACC doing second dose vaccinations today for those who'd received their first. But for those who weren't part of those community groups, we want to make sure that you're paying attention to the announcement that came out today to go to the FEMA events at the Dover International Speedway that the governor just mentioned are starting hopefully February 20th. Additionally, those who got their vaccine at the Dover DMV and did not get their second dose yet, as well as those who got their first dose at Delaware City DMV and the Georgetown DMV. We really want you to take advantage of the FEMA events, the 6 days, the 5 or 6 days at the Dover International Speedway, where we've got plenty of doses for everyone who attended our events. This really is your best chance, your easiest chance really, to make sure that you get your second dose of your vaccine. For those who got their vaccine at the Chase Center, we'll have an announcement coming soon where we'll very likely be returning to the Chase Center for your second dose. So you don't need to sign up for the FEMA events. I wanted to take another moment to talk about second doses. As I mentioned, we've had 34,000 or more second doses administered already. We are finishing up our first responder second dose events. This past weekend in Harrington, we vaccinated over 500 first responders, and we just have a couple more of those events left. So almost done there. But we're really messaging to our vaccinating providers that if you provide the first dose, it really is your obligation to provide the second. And when we do our allocation of vaccines, we're keeping that in mind. Right now, we are really focusing a lot of our allocation last week and this week on second doses to make sure that we have an adequate amount for those who need their second doses. That includes, all of our providers, so all the hospitals that we work with. We know that there might have been a little bit of confusion last week. Christiana Care had sent out a message to many of those who had provided their first dose that they should look elsewhere for a second dose. And after additional conversation with them, we assured Christiana Care that as we get supply from the federal government, we are and will continue to provide second doses to them. And so many of you may have seen that they have revised their guidance since that time to make sure that they're able to provide the second doses as well. So with that, I'm going to hand it back to you, Governor, and thank you.
Yeah, so thank you, Dr. Rattay, for all that. Thanks to our partners. What should be very obvious from that report is that the issue here is supply. Lack of supply of life-saving vaccines that we need to make sure that Delawareans are safe, particularly our vulnerable population. So we followed the priorities and the guidelines, the 1A. 30,000 of the first 50,000 doses that we received went to our hospitals, frontline hospital workers, healthcare workers. They helped vaccinate other healthcare workers in the community, first responders. Then we opened it up to those who are 65 and older. You may remember that the federal government recommended 75 and older. We expanded that as an equity concern, recognizing that there are communities of color have a shorter life expectancy than the general population. And so we widened that out. At the end of the day, it's simply about supply, our efforts to get fast and fair, as many doses out as we can in an equitable way. We're making progress there with our community partners, and we'll continue to lean into those objectives. AJ, tell us about testing and more about vaccination clinics. I know we have a big opportunity coming up to get second doses out to thousands of people who receive their first doses through the DMV clinics in Salesianum School.
No, absolutely, sir, and good afternoon, everybody. So I think, the governor teed it up pretty well, and so did Dr. Rattay, about supply being what's needed here. So, just within the last hour, we talked about how this changes quickly. We're getting ready tomorrow at 11 o'clock for those individuals that went to either Salesianum or the DMVs during January to come get their second doses down at Dover National Speedway starting this Saturday. Well, Mother Nature might be throwing us a curveball with that. We have a lot of our federal partners that are coming in from the Texas area. If you've seen the news, they've had some, very serious storms down there, stuff they haven't seen in, decades, snow and ice, power outages because of the heating demand, et cetera. So we are going to launch our site tomorrow for people to sign up. It's going to be de.gov/FEMA. It's going to open up 11 o'clock tomorrow. We are still in negotiations and kind of discussions with our federal partners whether or not we will accept reservations for the 20th. We might slide it and make the first day the 21st. But either way, we're going to have up to 6 days of vaccinations, be able to get the 18,000 number. We might just have to shift everything kind of one day down the road to align for not just whether that's happening there, but also keeping an eye on what's going to happen here Thursday and a Friday, knowing that there are the two training days we're going to have with about 200 individuals coming from multiple federal agencies to assist Delaware. So let's talk about the registration process. This is not going to be the VAMS process that we saw for those individuals that did it before, about 10,000. This is going to be a much more abbreviated process. Simple process, no login, no profile needed. You sign up, put in some of your information, email address. You pick on what event you got your first vaccination event. Was it the Delaware City DMV? Was it the Dover DMV? Then you're given the time selection to have over whatever days we open up in the hours allotted. From there, you get the confirmation. Make sure you bring your vaccination card to the site. So we make sure we get the right vaccine. We will be administering both Pfizer and Moderna next week at Dover International Speedway. So we want to make sure we could validate it. We also put out information last week to the email address if you need to get confirmation of when you got your dose and what you got the first time, so you can make sure you have that to make sure the nurses and the clinicians on scene have much information to make this go as seamlessly as possible. So tomorrow, 11 o'clock, you could start signing up. We're going to probably put 5 days out to begin with, fill those 15,000 or so spots, give us a snow day if we need it, and then open up a 6-day when needed. So if you went back to the chart that Dr. Day was talking about, the state's plan that the event next week in Dover is going to provide the second dose for anybody that went to those DMV events through January. I know there's people that were kind of like, hey, why do we have to go to Dover? And there's an efficiency there. It's, we're going to be doing 18,000 vaccinations over the course of, 5 days. We have, 200 plus federal partners coming in here, not including the assistance we'll need from DelDOT and law enforcement and local EMS agencies to support this. And it's just that economy of scale. We want to get the second doses to people. We want to get to them as close as possible to that 21, 28 day time period. And this is what's going to help us get that done. So kind of need to make sure this is your best opportunity to get that in that timely fashion. So de.gov/FEMA tomorrow, 11 o'clock to sign up. Go over a few testing things. It wouldn't be a press conference if I didn't talk about testing. We didn't put the numbers in here, but last week, the prior week, we did about 38,000 tests, I believe. We said a lot of that was weather. We still had some inclement weather last week, but we were able to get back up to just under the 42,000. So as Dr. Tay says, you test more, cases are going to go up a little bit more. So we're excited to see people still having those testing options. If we go to the slide with the Newcastle County sites for this week, we have ample opportunity this week, a lot of big sites. Remember, this is on top of the Walgreens, the state service centers, and the state clinics that are doing Monday through Friday testing. So the capacity is out there for us to keep hitting that 200,000 mark if we wanted to. We are not slowing down the tempo. We have ample capacity out there. Again, thank you to Newcastle County government for supporting and really doing the logistics for the drive-through events in Newcastle County. Kent County, we have multiple sites as well with the trailers. We also have the rapid site at the Modern Maturity Center as well that you can sign up for, which thanks to the National Guard and the team here, we're at several days a week. And then Sussex County, a little bigger geography to cover, so we have a few more sites that we have down there. But again, we have just under 10 sites there that will be 11 sites will be facilitating this week as well. So that's testing, vaccination, a lot more to come on the vaccination front. We'll keep everybody updated as the weather rolls in. Thursday and a Friday here, we want everybody to be safe, as well as if there's a delay with getting our federal partners here due to the events down in the Texas area this week. So, sir, back to you.
Yeah, so a lot of work there, over 40,000 tests done in a week, 20 to 25,000 vaccinations. That's an incredible workload. And we're able to test, and we've been testing now for months in an equitable way. Our tracker has all that data for you if you want to take a look at it. That's our goal, fast and fair with respect to vaccinations. And it's just a matter of supply, which will continue to ramp up. One of the things that was discussed with our White House call this morning was the potential for the Johnson & Johnson single dose vaccine, which is going before the FDA in a week or so, and hopefully get approval, emergency use approval within several weeks. They did indicate that there's not a lot of additional supply ready to go, but the expectation is 100 million doses across the country by June. We need them before June to get to where we want to be as a state, but that'll be a real game changer. It's also obvious that going back to the issue, it's about supply, that we're using more of the allocation this week for second doses than we are for first doses. And so we're not able to get to that next group of employees that are eager to be vaccinated, those folks that are under the age of 65. We continue to complete first responders, 1A and 1B, those over 65, the most vulnerable, the most at risk, and we're moving through that population as fast as we can, again, with the overall objective as fast and fair. And so with that, don't it's not time to let your guard down. It's time to double down on COVID-19 mitigation efforts. Wear your mask, double it up, be extra cautious. We want to get to a place where we've reduced the spread. It's also important to note, and I've said this, that one of the biggest challenges that we've had is getting children back in school. Every school district that across our state now has a number of children back for in-person instruction. We really did lean into that, working with the schools and the school districts and the teachers and the staff with the break that we took prior to the Christmas holidays and another week into January. But last week, I think the tracker indicates that 65,000 public school students are back for in-person instruction. 10,000 private school students are back or have been in school for in-person instruction for some time. And you can look on our website, the number of positive cases in the schools is a fraction. I think it's 71 for 51 for children that were in in-person instruction. That's 51 out of 65,000. And for the private schools, 17 for those who are in person, 10,000 private school. And so we'll continue to work on that. I want to thank all the teachers and staff and superintendents and principals and assistant principals for really leaning into that. We know that it's a safer place in school for children. Children wear masks. They keep socially distanced. They keep their guard up. And we haven't seen a spread, even though there's been more spread outside of the schools. That's a really positive thing, because we know that the best thing for children, particularly children from disadvantaged backgrounds, is to have that in-person instruction. So we'll continue to work on that and appreciate our partners with that. And so with that, open it up. I know we have a number of folks who've joined us for questions.
All right, first we'll go to Meredith Newman with the News Journal.
Hi, can you hear me?
Yes, we can.
Hi. I'm curious if the state has seen any hesitancy amongst healthcare workers in terms of getting the vaccine, and if there's any estimates or projections on how many healthcare workers or folks in 1A will just choose to not get the vaccine.
We have seen that anecdotally. We have regular meetings, as you know, phone calls, conference calls with the hospital administrators. At one point, one of the hospital systems returned a couple thousand doses for one of our DMV clinics several weeks back because they had some hesitancy among staff, and others have seen the same thing. Dr. Rattay, anything more on that?
No, I mean, we aren't surprised that we have seen some vaccine hesitancy among the 1A groups. What we saw, especially since the vaccine rolled out over the holiday season, is people were a little reluctant to jump right in and get vaccinated during the holidays. The interest in getting vaccinated certainly increased. We saw some variability across our hospital systems. As the governor just said, some seem to, have much less vaccine hesitancy than others, but we're really grateful to, all of our healthcare partners who were part of our campaign to get themselves, to get a picture and to tell us why they were getting vaccinated. And we think that really helped a lot.
And we did hear recently that people are coming around, right? And so that was kind of an issue. How long do you wait for somebody to come around, as opposed to moving that allocation of vaccine to another population, which is a difficult question.
And in terms of the Johnson & Johnson vaccine, if and when that will be approved, what's the plan for distributing that? And will it be targeted to a specific population since it is a single dose?
Yeah, so I'll turn it over quickly to Dr. Rattay, but what we heard from the White House Task Force is that there will be a review by the ACIP with some sort of recommendation, I guess, as to distribution.
Yeah, so we're eager to hear the ACIP recommendations, but we're also trying to proactively get ahead of this as well. We know that because the studies suggested slightly lower efficacy, granted, I think it's really important to mention that all of these vaccines are very effective in eliminating death and decreasing hospitalization and serious illness. But we are conscientious about the fact that the Johnson & Johnson, there are some people who may be less interested because of the lower efficacy number. And so our thinking, which we really want our ethics committee to grapple with, is that really we want an informed public who understands the pros and cons of all the vaccines available. And one vaccine may be easier for them to get than another, depending on where they work or where they live. But we want to make sure that all Delawareans know that they have a choice.
And that last is a good point. I mean, the question will also be one of availability. Is there going to be at the same time availability of the 2-dose vaccine or not? Or will they ramp up the distribution of the 1-dose vaccine, Johnson & Johnson, more quickly and be more readily available? That's an unknown right now.
All right, next we'll go to Nick Cialino from Delaware Public Media.
Good afternoon. Does the CDC's updated guidance for K through 12 schools align with Delaware's plan to get kids back in classrooms?
So it does. It goes a little bit further. We took the time off, as I mentioned earlier, to go back and really work with schools, with teachers groups about to understand the connection between spread in the community, what you had to do within the schools. They do say on the White House call this morning, Dr. Walensky did say that these guidelines were not to be taken as a mandate to open or close schools, but really to underscore the need for the protective measures, mask wearing, social distancing, and the like. We're pretty comfortable with what we've put in place, working with the guidelines that we've had over the last months. We have direct experience with our private school and public school communities. They're doing really well. If you just look on our website right now with respect to the cases that have been in the schools, we're getting healthier in the community, and that's a good thing. Dr. Rattay, anything more on that?
Yeah, I mean, I think, Delawareans in many ways kind of wrote the CDC guidance, last August, and we've been implementing it since then. They're really promoting this layered mitigation strategy, including contact tracing, isolation, quarantine, social distancing, mask wearing, cohorting, and testing. And we've we have a lot of experience with all of that now in Delaware, to the degree where when we had very high case rates in December and January, we still were not seeing spread within our classrooms. And so, I think that guidance is really helpful for states that have not yet been able to get many of their schools open. But I think that Delawareans should be proud of how the school districts and the teachers and the students have done with implementing these strategies.
All right, thank you.
All right, next we'll go to Amy Cherry from WDEL.
Hi, everyone. Earlier this week, we spoke with Maria Matos of the LACC, who was critical of the state's vaccine equity approach. She said that if Hispanics and Latinos make up 10% of the state's population, then they should get 10% of the state's supply of vaccine, no matter how much is available. Why is that not the current approach to vaccine equity? And what steps are you taking now or planning to take to reach those communities?
Well, I would say a couple things. First of all, the LACC has been an important partner and was one of the first organizations that we reached out to. So I was a little bit surprised to hear and see Maria's comments. So we work with them back in the spring and through the summer on testing. Maria is a regular participant in our weekly calls that talk about just these issues. LACC has partnered with Christiana Care and others with testing supplies from the state. And in fact, for the Salesianum event, we reached out to them to try to get the diversity that we were looking for in that clinic. We have these equitable goals. There are legal constraints as to whether or not you can set things aside for particular populations. We certainly expect to have a distribution that looks like Delaware. That's our overall goal. We know that partnering with organizations like the LACC and other church groups, as we have been doing and continue to do, is the best way to get to some of those communities. If you look again on our website for testing, you'll see higher testing rates among African Americans and among Latinos. And we expect to at least have vaccination rates that look like the state. Dr. Rattay, anything else for that?
Yeah, I would like to add a couple of things. As Governor, you were just saying, it is extremely important to us that we are reaching our Delaware populations in an equitable way. And so really grateful to the many partners that we are working with. When we look at the data and we look at Delawareans who are age 65 and up, about 2% of the Delaware population is Hispanic, who is 65 and up. So we have vaccinated over 1% of that population. Now that's not good enough for us. And so efforts like today, we're in high-rise lush Jardines, which is, I think, 100% Latino. Additionally, AJ's team is at LACC today providing vaccinations. We are going to continue to partner with all of our Latino partners in the communities and the hospitals and FQHCs who have relationships with our community partners to make sure that we are reaching individuals.
I would just add to that we're working very closely, our Secretary of Agriculture, with the poultry processing companies for the vaccination of the employees and those companies, which are a significant Latino, Haitian Creole, African American, and Caucasian populations, and hope to be able to get through those workers quickly once their numbers come up.
Thank you.
All right, next we'll go to Tim Mastro from Delaware State News.
Hi, everyone. So what's the status right now of how much vaccine has been distributed in long-term care centers? And how does that affect the current status of visitation in those centers and just kind of in the near future as more vaccines distributed? Will visitation be opened up more?
So as you may know, I'm going to hand it off to Dr. Rattay pretty quickly. This was a separate program. In other words, there was a separate federal program in allocating doses of the vaccines to pharmacies for the purpose of vaccinating long-term care facilities, workers, and patients. We have not had any control over that at all. We do get the reporting. There are numbers that are incorporated in some of the numbers that we report, not all, which is something that can make those numbers a little bit misleading or confusing. But that's something that's a program directly between the federal government and the pharmacies and long-term care facilities. Dr. Rattay?
Yeah, sure. And we can get back to you with, more specifics, but the numbers I have are that 27,000 doses have been delivered through the long-term care federal pharmacy program, and 19,504 have been reported as administered in this program. By the end of January, all the skilled nursing facilities had been visited by either CVS or Walgreens, who are implementing this program, and now they are circling back around for second doses. So really grateful to have many of our long-term care residents and staff vaccinated. Uptake for residents has been great. We understand it's been about 80% of residents who have been vaccinated. We are eager to allow for visitation. We know it's extremely important for residents and families to be able to have visitation. We are, as we see a decrease in our numbers, I believe a couple of our counties are going to be able to allow visitation again soon, not all. And as we see second doses, we also are going to feel much more comfortable that residents are protected. So we're not quite there yet, but we are certainly getting to a better place and very much understand the importance of visitation for residents in long-term care facilities.
Mm-hmm. And what do you think is kind of the next step for long-term care centers in terms of it's probably been about a year that all these residents have been in isolation. Is there going to be any support provided to them to help them come out of isolation, to deal with the physical, mental wear and tear that comes with isolation?
Well, I do think that's a great question, and I do think that it's going to be individual specific. I think as family members get more time to spend with their loved ones, I think we will have more information. And of course, each long-term care facility will likely have a different way of addressing this. I do believe that they've all done the best that they can to try to help residents who are in isolation during this time. But we know that it's had an impact mentally and physically on individuals in these facilities.
All right, next we'll go to Chandler Parr from WRDE.
Hello. Can you guys hear me?
Yeah. Is that Chandler? Yes.
Yes. Hi, everyone. So my first question is, so the TSA said this past weekend air travel was at its busiest since the holidays. And I was told that even restaurants in Delaware were quite packed for Valentine's Day. So are you all worried about cases increasing after this past weekend?
Well, we're always worried about the increase in cases brought on by kind of inappropriate social activity. I think some of the situations you're talking about is not what wasn't inappropriate, is allowed by the regulations. So we just ask people to wear masks, to keep appropriately social distance, follow our guidelines, but we do, we're very cautious about the restrictions that we have for public gatherings and public spaces. I'm very feel really good about the mask wearing compliance that we have in our state, and particularly as reported by the mayors in our call earlier today. And so, until we get out of this, we're always looking at areas that we need to tighten up. We're always trying to strike that balance between a healthy community and a strong economy, and recognizing that a balance has to be struck. And we look at the numbers on a daily basis to determine whether we're headed in the right direction or not. We're clearly headed in the right direction, although, as Dr. Rattay says, there were some hot spots that were somewhat concerning. Anytime there's an event that takes place that we know creates more social interaction, you know, the whole Super Bowl kind of weekend and all of those events and parties that happened watching the game was a concern. Anytime you got more than one household interacting together, you have concerns. And so, yeah, we look at all those things and try to strike that right balance.
Okay, and my second question is, what is the number of people that we need to get vaccinated to reach herd immunity, if that is a goal of ours? But if so, do you think summertime visitors could impact this, let's say if they aren't vaccinated and could be shedding the virus?
Dr. Rattay, any thoughts on that?
Yeah, I mean, I think we all wish that we had a crystal ball and could predict the future. There remains a lot of unknowns. I mean, some of it, of course, is vaccine and vaccine supply. Then you throw in, as I heard the governor say earlier today, the wild card is the variants, and these variants that are contagious, more contagious, the UK variants, which, you know, we are seeing. And so we just don't know what is going to happen. So I hate to make any predictions as to what the summer might look like. I also hate to make any predictions around, you know, what's the right number for herd immunity, given these variants. Given the fact that we may see even more mutations, and we just don't know how each of these vaccines is going to respond to the mutation. So I wish I had the perfect answer, but we just, there's a lot of unknowns right now.
Thank you.
All right, next we'll move on to the pre-submitted questions. The first question is from Susan Campora at Coastal Point. You talked about this a little bit earlier, but she says, Governor and Dr. Rattay, we've heard many people say they no longer have to wear masks and wash their hands or stay socially distanced now that they have been vaccinated. Would you like to reiterate how important these precautionary measures are still, and how long does it take to build immunity after being vaccinated?
You still have to wear a mask, I think is the bottom line. And with that, I'll hand it over to the expert, Dr. Rattay.
Yeah, unfortunately, we still have to wear a mask, and one that fits snugly around our face, as we talked about earlier. And we still need to social distance, and we still need to test, and we still need to be cautious. As we were discussing earlier, we know that these vaccines, which again, you really don't want to consider yourself protected until you're at least 2 weeks after your second dose. But even then, 95% effective means there are some people who could still become positive. And then we just don't know yet if you could be a carrier if you have been vaccinated. So still more information that we need to gain. But at this time, we still have to continue with these mitigation strategies.
The next question is also from Susan Campora at Coastal Point. Is there a timeline yet for when a vaccine will be available for children?
I'll try to take my best shot at that as a pediatrician. I think we're eagerly awaiting studies and the results of studies of children, but we're not there yet. There are folks like Dr. Fauci who are estimating that towards the end of the summer, we're going to have vaccine available for children. I think we're all excited about the point in time when that happens, but we don't know with any certainty yet, as these vaccines have not been well studied in children yet.
All right, next we have two questions from Kyle Johnson from WBOC. They asked, appointments for second dose vaccination events filled up quickly across the state. How confident are you that supply will be there for everyone to receive their second doses within the CDC's recommended timeframe?
AJ, you want to address that? We obviously, let's take a step back and remember why we did the large clinics at the DMVs, almost a month ago now. And that was because we were advised to start pushing vaccines into people's arms by our federal partners, by the White House Task Force, that we were going to be, our future allocations were going to depend on our past performance in moving vaccines from delivery to administration. And so we had the larger clinics and they created the requirement for a second dose, 21 days, 24 days beyond that. We have a window up to what we consider our target of 35 days. 42 days is the date that the CDC has studied. On the White House Task Force call last week, they even talked about reserving doses for folks in 1A beyond the 40-day period. We're going to try to get ours out by that 35-day deadline, and so it's a bit of a math exercise, right, AJ?
No, I think math it is. So when we were building this plan of how do we get these second doses out there for everybody, we did in the sprint in January, we kind of looked at what our population was. And so we looked at the, I believe it was 8 different DMV events that public health did, the one at Sally's, looked at those numbers. And so we're doing 4,000 this week through the curative sites in the, in the 3 counties, 5 in Dover, 2 Wilmington, 2 in Sussex this day. So we'll get about 4,000 done there. We know we have about 18,000 people we could do through the Dover International Speedway. That puts us up to 22,000. And that's right in the same ballpark that we did through those events. We also know that, you know, some of the people that done our salaries are getting done today at the LACC, or they're being done other ways. So we built the plan for this week, last week and this week, to get the second doses that the state was obligated to get to the people that we did at the DMVs, and that was the plan. And numbers will align, so we know if you had a reservation on one of those, you'll have a spot. Caveat is, you know, log in tomorrow, find a time and a day that works for you, and that's going to be the biggest hurdle if somebody's, you know, the weekend fills up quickly or another day fills up quickly. But you know, we have 5, possibly 6 days of options that people could choose from to come down and get their best chance as soon as possible to get their second shot.
Right, the next question from Kyle Johnson at WBOC is, can individuals receive their second dose at a different location from their first? For example, if someone got the first dose at a Dover DMV state-run event, could they schedule an appointment at CVS for the second?
So we talked a lot about that, and I'll turn it right over to Dr. Rattay, but the idea is to get your second dose where you got your first dose. And with respect to the DMVs, to what AJ just described in terms of our large clinics. Dr. Rattay?
Yeah, not much to add. I mean, we are allocating second doses in alignment with the number of first doses. And so, you know, the expectation is providers that provide the first doses should also provide the second doses. That being said, you know, if you get an opportunity, a convenient opportunity, for example, if you're with your healthcare provider for your second dose, it's fine to do that. But really, we're suggesting people, you know, try to get their second dose where they got their first dose.
All right, this is the last questions from Matt Biddle with Delaware State News. Governor, when will you get your vaccine?
When my number comes up. So it probably won't be for a while. I'm not 65 yet. I'll be 65 in May. I don't know whether that changes my status or not, but I know this is difficult for all of us, and it seems to me it's an opportunity for me to lead by example, not try to cut in line, to wait for my turn, as we're asking everybody else in our state to do. If at some point it becomes necessary to convince people to get vaccinated, then I'll step forward, but it doesn't look like that's going to happen at this point. I know we've had people that have done that in order to get more of their workers vaccinated, and that's an important way of providing leadership. The J&J vaccine looks like a good one to me. You know, it's a single dose. Arguably, we'll see what the ACIP comes up with, but somebody that's a little younger and healthy as I am, maybe that vaccine works better. I know it'll help us with first doses for folks that are not in the higher priority groups. And so I'm going to wait till my number comes up, wait my turn, and get the vaccine that's available at that time. Anything else? I think that was the last one. Let me end by thanking Dr. Rattay and her team for their incredible work. Doctor, you should be a doctor, AJ, at this point, AJ Shaw, the director of our emergency management agency, working with Dr. Hogg, Dr. Pescator, all the teams out there on testing and vaccinating over 40,000 tests in a week, 20 to 25,000 or so vaccinations in a week. That's an incredible amount of activity, and really doing a great job making sure we're protecting every Delawarean. I'm going to focus on the positive. Our numbers are looking much better. We're on the downslope from this latest peak. That doesn't mean we can relax. That doesn't mean we don't have to wear a mask, keep appropriate social distancing, stay out of environment where there's a lot of mixing of households. What it means is that the light at the end of the tunnel that we've been talking about is a little bit brighter. We've got more vaccines coming. We've gotten more than 150,000 doses in people's arms already. It looks like 30 or 40,000 or more with their second vaccines. We're really leaning into second vaccines. We've got Johnson & Johnson single dose vaccine coming hopefully within weeks or a month. We can be optimistic, but we need everybody to continue to do their part. And if we do so, we'll protect our neighbors, our families, and ultimately those that are most vulnerable in Delaware. So thank you for joining us again this week, and we look forward to seeing you the next time.